We're celebrating a 10-year anniversary of the Tobacco Free Act, an act which has helped ensure that both the workers in the hospitality industry as well as the individuals visiting restaurants throughout the state don't have to be exposed to tobacco. We're also celebrating the fact that we've reduced smoking rates in Louisiana from 24 to 21% during that time. So we're excited about progress, but also recognizing we have a lot farther to go.
Good afternoon, everyone. I'm Tanya Moore, the director for the Louisiana Campaign for Tobacco-Free Living. We're part of the Louisiana Cancer Research Center as well as the Louisiana Public Health Institute. January 2007 marks the 10-year anniversary of one of the most significant victories for public health in Louisiana, the passage of the Smoke-Free Air Act, also known as the Louisiana Smoke-Free Air Act, Act 815. During the 2006 Louisiana regular legislative session, Senator Marino, who's joined us today, after having worked closely with the Coalition for Tobacco-Free Louisiana, advocates and other partners across the state, introduced Senate Bill 742. It was passed and signed into law by then Governor Kathleen Blanco to prohibit smoking in buildings, schools, and other places, inside places of employment, including the main place, restaurants. Senate Bill 742 also became the public health champion of that year. Since the Smoke-Free Air Act went into effect, dining without having to request smoking section or none became the new normal. It is then, and employees were able to breathe, families were able to come out and enjoy their dining experiences. According to the National Restaurant Association, states that restaurants are one of the leading driving forces in Louisiana's economy. This, along with the fact that Louisiana's hospitality employment has increased after the Smoke-Free Air Act, clearly demonstrates and shows the restaurant industry and those who work and visit them have benefited from this passage of the Smoke-Free Air Act over the last 10 years. Louisiana continues to make progress in our fight against tobacco's influence across the state, thanks to our partners, parish and city smoke-free ordinances, and recent tobacco tax increases. At this time, I'd like to bring up Dr. Rebecca Gee, Secretary of the Louisiana Department of Health, who can tell us more about the health status of Louisiana and its health. Thank you. Dr. Gee.
Good afternoon, everybody. I am delighted to celebrate this anniversary. I'm humbled by the fact, however, that we need to do more. The one thing to celebrate today and tomorrow is the one-year anniversary of Medicaid expansion in our state, which is tremendous. We have 375,000 individuals covered. And a big challenge, of course, to smoking cessation was that individuals who don't have health insurance coverage often don't have optimal access to coverage for, coverage for the things that they need to do to quit smoking. But in the state of Louisiana, because of, in part, expansion, we are now 49th, not 50th in the nation on the health rankings. But we're going to get much, much higher. In fact, if we had looked based on the timing of expansion, we didn't get full credit for that. We probably would be about 46. So we're moving up in health. We've made great progress in smoking. We've gotten to about 24% of people in the state of Louisiana smoking to 21%. That improvement is something to be proud of, but we're certainly not there, and we need to do more. We know that smoking costs us about $2 billion, that's with a B, per year for this state to care for the chronic conditions and other issues that are caused by smoking. And we need to do more. We need to make it more difficult to get packs of cigarettes. We need to educate our kids and not have them smoke. We need to make sure that city after city in Louisiana is smoke-free. And that when we do put smoke-free laws in, it helps the hospitality industry. It helps the employees working in those jobs. It makes them have a safer and healthier environment and improves the experience of all those who are not smoking in those restaurants and in those entertainment venues. So it's important to continue the fight. I want to see our local communities in our state do more to reduce the levels of smoking in our state, and I'm really proud that we have such tremendous advocates, the Louisiana Public Health Institute, the Louisiana State University School of Public Health, and others who for years have really been in the battleground and in the trenches on these issues. So thank you to Tanya. And I also wanted to recognize Dr. Brooks, who has been practicing for decades and has been a medical oncologist who's very, very dedicated to individuals who unfortunately have been exposed to cigarette smoke and then have health consequences. So today is a time to celebrate, a time to recognize those who have been advocates in our state to reduce smoking, but also call for action that we need to do more. That 21% of adults who smoke is just simply too high and unacceptable. So we have a long way to go, but we have come far and are proud of our achievements.
I'm Dr. Jay Brooks, and I'm a medical oncologist at Ochsner. As I was thinking about today, it's almost 80 years ago that Alton Ochsner and his student Michael DeBakey first linked tobacco with lung cancer. When I started practicing in this community 30 years ago, believe it or not, patients smoked in their hospital rooms. That's how far we've come. We still have a long way to go. I think it's critical that this law was passed over 10 years ago and has done a tremendous amount to make smoking not fashionable where we eat and enjoy ourselves. We still have a long way to go. There are still thousands of our Louisiana residents who are exposed to second and third hand tobacco, who work in bars and casinos that still need our help. And hopefully, in the local level, in the state level, we'll be able to help them to avoid those exposures of secondhand tobacco that will help them and their families to avoid the consequences. So I congratulate our state today, but we still have a long way to go.
And at this time, we have two special guests with us today. Both led the fight, one on the House floor, Representative William Daniel, and also Senator Robert Marino on the Senate side. So I'll let both of them come up and talk about their challenges, what happened, and where do we go from here, and a call to action to other legislators. Thank you.
My name is Robert Marino. I was in the state Senate at the time the bill was filed, and along with me today is Representative William Daniel, who I also owe a debt of gratitude for his taking up the cause over on the House side. I spent 16 years in the legislature, and I'm happy to say that this is probably the most memorable piece of legislation that I was involved in. I took up the baton after then Senator John Johnson, who had tried for several years to pass the legislation. I picked it up when I moved over from the House to the Senate and started running with the ball. None of these pieces of legislation are possible without counterparts on the other side of the aisle, without lobbyists or information givers, who two of which are here today. Terry Broussard and Cindy Bishop worked tirelessly on this legislation. At times we fought, at times we cried, at times we hugged. I was a bit disappointed in that we weren't able to include bars and casinos, and I like to partake in both, but I would like to partake in both in a smoke-free atmosphere. So when it became obvious after a couple of years of even my defeat of the bill, that we had to take a piece of this elephant, the old adage of how do you eat an elephant a bite at a time. When we let bars and casinos fall off, it became a little bit of contention among the American Heart Association, American Cancer Society, and others. But I think we've gone a long way in the start of the fight. And as the Baton Rouge Metro Council took up a vote just several months ago, and it was a tie vote of 6-6 to ban it in casinos and bars, I think you've got to take that one more bite of the elephant a piece at a time. And be it here in Baton Rouge or be it in New Orleans, I think those steps are important. I was happy to be a part of this process. I think it is one of the better things that has happened in this building in a long time. At the time, then cardiologist from Lafayette, Dr. Langston Lurchman, testified that there would be over 200 lives saved per year. So in just these 10 years together, we have saved more than 2,000 Louisiana lives, and for that, I'm very proud.
Well, I have to give Senator Marino all the credit. He did all the work. He asked me, he said, if I get this bill over to the House, would you handle it? And I said, sure. And I knew that I was not going to have to handle the bill because there was no way it was coming over to the House. And it did. So we had a very intense session so that I could completely understand everything in the bill. But I have to say that no bill gets passed without a lot of work by a lot of people. And that bill was very well explained to the members of the House. And even though I think the debate was 5 or 6 hours, it was a long time, the bill survived intact without any amendments. and we are a better state today. So I would like to give credit to all the people that lobbied the bill, to Senator Marino who had the courage to do it, and to my to the people that I served with that got us over the 53 votes. And again, like Senator Marino said, when I think back over the 12 years that I spent in the legislature, this is really one of the highlights of the bill. My mom, she had a heart attack. She smoked all her life. She's on oxygen now. I just think what a better quality of life she would have today if she had never smoked. So I'm hoping that we have saved a lot of young adults from that same fate in the future. So I appreciate you inviting me here. Thank you very much.
Thank you to all our guests, and that was two great, powerful stories that you heard from our legislators who actually helped to make this happen. And since then, part of the Smoke-Free Air Act gave local policymakers the ability and authority to enact stronger, comprehensive smoke-free policies at the local level, in which the state did not cover as far as the bars and gaming concerned. In the last 10 years, there have been 10 cities that have adopted comprehensive smoke-free air policies, New Orleans being the most talked about, but we just had a recent passage in Bogalusa, Louisiana, being the 10th. Through numerous pre- and post-smoke-free ordinance air quality monitoring studies, we know that indoor air quality can go from hazardous to good to measure that of outdoor air quality. Within weeks, a business going smoke-free reduced the air quality tremendously, as you see on these examples here from the Monroe area, Alexandria, and New Orleans. Air pollution decreased significantly. Additionally, a recent study by the Louisiana Public Health Institute found that the lung function of healthy, non-smoking adults who had been in a smoky bar, for about 3 hours significantly decreases their lung capacity both right after leaving and 2 hours of recovery time post. From a final perspective, Louisiana pays an estimated $1.89 billion with a B each year in healthcare costs directly related to smoking. That breaks down to nearly $1,182 per household here in the state. So with that, those burdens, we need to do more, strengthen our coalitions, get our advocates ready to realize that there is no risk-free level of exposure to secondhand smoke. While the victories have helped make an impact around tobacco prevention and control, they are not enough. There's still a lot of work to be done. We need to support the efforts of Dr. Gee and the Louisiana Department of Health as the leader in health across the state, as well as our current legislators and municipalities and those in the hospital healthcare system to help make this a reality. We're a comprehensive organization that focuses on a lot of tobacco control issues. So other things is making sure that we prevent youth from ever taking up the habit. We promote resources to help people quit smoking, and we definitely want to eliminate secondhand smoke in indoor environments, and as well as eliminate disparities among tobacco-related health care disparities, because we know in our rural communities and our minority populations, we see a huge increase, more prevalent smoking rates in those communities.
I'd like to see smoking rates go down. I'd like to see no kids pick up a pack of cigarettes and start smoking. I do think over time we need to think about higher tobacco taxes. We need to think about regulations for teens and youth and make sure that they're strong, that they can't buy cigarettes, make it more difficult for them to get access to cigarettes, make it so that employees who work in industries throughout the state that support our economy don't have to be exposed to tobacco. We've come a long way, but we still have a lot farther to go. And Louisiana still continues to have some of the highest mortality or death rates from cancer in the nation. So, this is a priority. Smoking costs us almost $2 billion a year. It's over $10,000 for every household in our state that we pay for the costs of individuals who smoke. So I think we need to do a lot more.
We've seen a decrease in smoking rates over the last 10 years among Louisiana residents, which is a good thing. We're still higher than the national average, but we're continuing to decline year by year. And so it's victories like the Smoke-Free Air Act that help to decrease smoking in the state.
Everyone be healthy, and make sure that if you are smoking, you can go to healthy.la.gov and sign up for Medicaid, or go to, there's still time, it's still open enrollment, in healthcare.gov to sign up for health insurance and make sure that you can get the treatment you need to stop.
We just invite people to get involved with the movement and help us to make the state become healthier and smoke-free. We have our healthierAirForAll.org website, or they could visit us at tobaccofreeliving.org.